Uh, I'm Jack Kavanagh, the husband of Barbara Kavanagh, who founded Arizona Myeloma Network about 6 years ago. And the purpose of the organization is to advocate for patients, to educate patients and others in the community about multiple myeloma. I contracted multiple myeloma, or was identified as a multiple myeloma patient around 1991, I think it was, and I'm one of the fortunate ones who has lived beyond the average life of a multiple myeloma patient. But I was lucky. I was diagnosed early, and one of my luckier events was I happened to be working in Wisconsin, and my doctor recommended that I go see Dr. Robert Kyle at Mayo, who was preeminent in the multiple myeloma field and still is. And I'm very happy to be seated next to him today because he was my early doctor, and he recommended some medicines and procedures that I'm sure saved my life, and I'm very grateful for that. Dr. Kyle has been very generous with his time for us. He's come down here for our annual meeting. He came last year, and he's here again this year. And one of the things I feel is that he's very, very interested in patients and the feedback from patients. There are many researchers out there who do wonderful work, but some of them don't care that much to interact with patients, but others like to do that, and Dr. Kyle certainly does, and we appreciate his presence very, very much.
Well, thank you very much, Jack. When I saw Jack 17 or almost 20 years ago, he had multiple myeloma, as he mentioned, which is indeed a serious disease. He was treated and did well, and then one day after he had moved from Wisconsin to Arizona, he said that he'd had an offer to work in Korea, and I told him that this probably wasn't a real good idea to get this far from the U.S. with a serious disease. And then I didn't hear anything of him for some time, and then I got a message from a former fellow of ours who was a professor of hematology in Galway, Ireland. And he said that he was seeing this patient, Mr. Kavanagh, and that he was indeed doing well. And I was very pleased to hear that because many patients with the disease at that time would have not done nearly as well, let alone working in a foreign country and, quote, feeling very good. And of course, the proof of the pudding is today when Jack has now had this disease for 20 years. This is a very important lesson for everyone, for every patient who has the diagnosis of multiple myeloma. Many people who receive this diagnosis have never heard of the disease before, and then secondly, they're told that there is no specific cure for this disease. It's a very, very frightening situation. There are patients like Jack who do well, and there are a number of foundations that provide ongoing patient seminars with multiple myeloma. And it's important for patients to participate in these seminars because, for one thing, they see another patient who has the disease, and when they're newly diagnosed, they are very, very frightened. But when they go to a patient seminar and they find these patients who are going 5, 10, 15, 20 years, and when they look at the patient and the patient's spouse, it's impossible to tell which is the patient who has the disease and who is not. And that is a very, very important thing for the newly diagnosed patient to see what others have done, and that treatment is much superior as time goes on, and that everyone is in better shape than they were a decade ago.
First of all, I'd like to clarify, I was not on the run or anything going from Korea to Ireland. That was my job. I was with an international engineering construction company. And I have to admit, it was worrying for me to go overseas. And before I went to various countries, I worked in something like 14 countries over my career. I always would check to see that there was a doctor there were some facilities there where I could get some treatment. But I think one of the things I'd like Dr. Kyle to just comment on is his interaction with patients and their caregivers at a meeting like this. Do you find that enlightening or just enervating for you to be able to see patients who are getting knowledge and are concerned about their disease and want to do the right thing and get treatment, get the best treatment, and know about the best treatments?
First of all, Jack, I didn't want to imply that Interpol was after you or anything like that. It is very rewarding to see patients at these patient seminars, these patient meetings like the Arizona Myeloma Network and other meetings, to see patients and to see how they are doing, and one learns from the patient. As a matter of fact, we as physicians need to know how the patient does in the long run, and it's very, very important in evaluating the treatments and so forth that we use. The other point I will make is that many patients become very, very knowledgeable about multiple myeloma. They read about it, they hear other patients, they go to the seminars, hear lectures and that sort of thing, and actually many patients end up as more knowledgeable than some of their physicians do about the treatments for this disease.